Sulfur burps can appear while you use Ozempic, the brand for Semaglutide, or Mounjaro, the brand for Tirzepatide. The rotten egg smell comes from hydrogen sulfide gas, not sulfur inside your weekly injection. Slower digestion creates the conditions, while fatty meals often provide the trigger. Smaller meals and avoiding your trigger foods can reduce episodes, while mints only cover the smell. These medicines slow the movement of food from your stomach into your small intestine. Food stays in your stomach longer, and gas can build during digestion. Gut bacteria can break down certain food compounds and produce hydrogen sulfide, the gas with that rotten egg odor. When that gas rises, you notice the rotten egg smell as you burp. Your medicine does not rot food or poison your stomach. Slower movement can make pressure build after you eat. A meal that once felt normal may now sit heavily, especially after a dose increase. You may notice fullness, bloating, nausea, and repeated foul-tasting burps. If those symptoms begin or worsen after an increase, the new dose is an important clue. I first ask about meal size because food leaves your stomach more slowly. A large dinner can remain uncomfortable for hours. Add fried food, creamy sauce, alcohol, or dessert, and your stomach must handle more fat and volume. The next morning may begin with pressure and a rotten egg burp. Carbonated drinks create another problem. They add gas directly, so you may burp more often. Drinking quickly, chewing gum, using straws, and talking while eating increase swallowed air. These habits do not create sulfur gas, but they make the odor easier to notice. Some foods contain more sulfur compounds for bacteria to break down. Eggs, garlic, onions, broccoli, cabbage, cauliflower, and large servings of meat are examples. The useful clue is repetition. A food is more likely to be a trigger when symptoms return after eating it on different days. Protein shakes can worsen burping for reasons unrelated to sulfur. Some contain sugar alcohols, which are sweeteners, or lactose, the natural sugar in milk. If you are sensitive, gut bacteria can break down these ingredients and produce extra gas. If burping and bloating return after each shake, check the ingredient list. Extra gas can make you burp more often, making an existing sulfur odor easier to notice. Test suspected foods one at a time instead of removing every sulfur-containing food. Eggs or broccoli are worth limiting only when symptoms repeatedly follow them. Removing everything can make your diet less nutritious without finding the real trigger. Food is not the only issue. These medicines can also cause constipation, which may trap gas and increase pressure. Look for fewer bowel movements, harder stool, or increasing lower abdominal pressure. As constipation improves, your upper bloating and burping may improve as well. Covering the smell does not correct slow digestion. Tea, mints, and supplements usually cannot overcome repeated large meals when your stomach empties more slowly. Your weekly injection changes how much food feels manageable. Keeping the portions you ate before treatment can bring symptoms back, even when every ingredient seems healthy. Portion size still counts. Meal spacing matters when fullness lasts for hours. If you are still full from lunch, a snack or early dinner adds more food before your stomach is ready. If the previous meal still feels heavy, make the next meal smaller and lower in fat. Start with portion size, not a long forbidden food list. Serve yourself less, pause halfway, and stop when you begin to feel comfortably full. Eating slowly gives fullness time to register before you eat more. Do not chase the old feeling of being completely stuffed. Fullness may keep building after you finish eating. Pay special attention to fat because fatty meals usually leave your stomach more slowly. Fried chicken, pizza, burgers, sausage, rich cheese, and creamy dishes can be especially hard to tolerate. The medicine slows stomach emptying, and the fatty meal slows it further. Fullness, nausea, and burping may then worsen at night. After a dose increase, keep meals smaller for several days and watch how your stomach responds. Choose lower fat foods. Lean protein, cooked vegetables, and a small serving of starch are often easier to tolerate. Keep sipping fluids if nausea reduces how much you eat or drink. Large drinks with meals can worsen fullness, so sip between meals instead. A gentle walk after eating may ease pressure. Remaining upright can also reduce reflux. Vigorous exercise immediately after a heavy meal can worsen nausea. If your pattern is mild, pay attention to dinner timing. Finish dinner earlier when possible, and avoid lying flat soon afterward. A late meal has less time to leave your stomach before sleep. Alcohol and high-fat restaurant meals can make that nighttime pattern worse. Heartburn and sulfur burps can occur together, but they come from different processes. Acid reflux causes burning, sour-tasting fluid in your throat, or chest discomfort. Hydrogen sulfide causes the rotten egg smell. Treating only heartburn may leave the rotten egg burps unchanged. Choose over-the-counter medicines by the symptom you have. Simethicone, a gas relief medicine, may reduce discomfort from gas bubbles, but does not correct slow stomach emptying. Acid-reducing medicines may help those reflux symptoms, but they usually do not stop rotten egg burps. Some fizzy antacid products may add gas, while breath mints only cover the odor. Frequency, pain, and vomiting tell you more than the smell. One episode after a heavy meal points toward meal size. Burping after most meals makes one specific food less likely. Check meal size, constipation, and recent dose changes instead. If episodes are occasional and you have no pain or vomiting, start by reducing portions and choosing lower fat foods. For 1 week, keep a simple log. Write down your injection day, meal size, fatty foods, bowel movements, and when the odor appears. Burps after large dinners point toward meal size. If symptoms worsen after each dose increase, the medicine is more likely contributing to the problem. If symptoms began soon after a dose increase, contact your prescriber before increasing again. You may need more time at the current dose or a lower dose. Do not increase simply because the calendar says it is time. Mild symptoms may improve at the current dose as you eat smaller meals and your body adapts. Improvement means fewer episodes and easier eating. If symptoms worsen or make eating difficult, contact your prescriber rather than testing more foods. For mild symptoms, use a simple sequence. First, reduce your meal size. Then choose lower fat foods, avoid your most consistent trigger, manage constipation, and finish dinner earlier. If the pattern continues, review the dose and other causes with your prescriber. Do not keep testing foods if fullness continues into your next meal or you vomit undigested food hours later. These symptoms can suggest gastroparesis, meaning your stomach empties too slowly. Severe upper abdominal pain, reaching your back, can signal pancreatitis, meaning inflammation of the pancreas. If your abdomen becomes swollen and you cannot pass stool or gas, seek urgent medical care. Repeated vomiting or inability to drink can cause dehydration. Watch for dark urine, dizziness, weakness, or very little urine. The rotten egg odor comes from hydrogen sulfide gas, not sulfur hidden in your medicine. Slower digestion, large meals, and trigger foods can make the burping more likely. Eat smaller meals, choose lower fat foods, avoid your triggers, and finish dinner earlier. Burps with severe pain, repeated vomiting, or dehydration need medical attention. Medicine simplified. That's what this channel does. If you want more, hit subscribe. This is not medical advice. Consult your doctor.